Dear all, I am Dr. Emre Pabuccu. I am OB/GYN and gynecologist as well. I am working in Centrum Clinic since 2015 and we are providing best medical services for our gynecologic and other patients as well. Today, I am going to summarize the uterine fibroids for you. As you all know, uterine fibroids are very common. What are uterine fibroids? These are benign, smooth muscle masses or non-cancerous tumors of the uterus. As we all know, the uterus is made up of smooth muscle cells, and these myomas are made up of the smooth muscle layers, and these are all benign, non-cancerous structures. How common are uterine fibroids? Very common. As we all know, we can diagnose fibroids 4 out of 10 women worldwide, so it is so common, and we can easily diagnose these kind of fibroids using sonography, either abdominally or vaginally. What causes uterine fibroids? We don't know, but we are aware that fibroids are rising from genetic predisposition and ethnic predisposition, also family history, which we call it genetic predisposition, excessive estrogen therapies, obesity, and vitamin D deficiency. However, exact cause is unknown, but it is very common. What are the symptoms of uterine fibroids? The most common symptom is no symptom. Therefore, every woman should be aware of these kind of fibroids and should have take her annual controls by sonography. The other symptoms are excessive uterine bleeding. In other words, excessive or heavy periods, and also prolonged bleeding and intercycle bleeding, pain, constipation. Furthermore, uterine fibroids cause infertility, miscarriages, and preterm deliveries as well. As we already understand that uterine fibroids are very common and may cause serious problems. So we may use sonography and other diagnostic tools to diagnose uterine fibroids. So how are we going to treat these pathologies? Treatment for fibroids can vary depending on the size, location, number of the fibroids, as well as what symptoms they cause. If fibroids don't cause any symptoms, we may let them go and we may track them in every 6 months using ultrasonography. If fibroids may cause severe symptoms like bleeding, pain, infertility, miscarriages, and the history of preterm deliveries, then these kind of fibroids may require surgical treatment. And also, what type of surgery we need is mostly depends on the size of the fibroid, the location, and the number. So the major surgical procedure is myomectomy. Myomectomy is removal of the entire uterine fibroid from the uterus, even the cavity or in the muscle layer. It is the removal process by surgical procedure. So which kind of surgical treatments we have? We may remove these kind of fibroids by using laparotomic incision, which is a classical incision, and also we may use laparoscopic approach, which we call it endoscopic approach, by using the sticks and the optical camera. And as we all know, the removing fibroids by a laparoscopy may require morcellation procedure, and these morcellation procedures are now under investigation. So we are performing laparoscopic myomectomy with contained bags with, we have to prevent the excessive amount of cells to spillage around the abdominal wall. We have laparoscopic myomectomy, we have laparotomic surgical classical incision myomectomy, and we also have hysteroscopic approach. If a woman have the fibroid inside the uterine cavity, let me show you the uterine cavity. We call it submucosal myomas, fibroids. We may use hysteroscopic approach as well. In hysteroscopic approach, we are pushing our optic inside the uterine cavity, and by resectoscope procedure, we are shaving the myoma, in other words, fibroid, and we may discharge our patient in the same day, which we call it day care procedure. In conclusion, if you have a uterine fibroid or if you are suspicious of a uterine fibroid, we have to perform sonography, and if we detect this fibroid is a severe condition, we may offer a surgical procedure for you.